All right, get ready, because today we're going to take a deep dive into an article with a pretty outrageous title, The Knee Replacement Surgery. HOAX, Doctors Hide From You.
Yeah, that's definitely attention grabbing, isn't it? I mean, using the
Ah.
word hoax is, well, pretty serious stuff.
Totally, especially when you're talking about something like knee surgery.
Right. I mean, that's a major medical procedure,
Exactly.
and people need reliable information to make informed choices about their health.
And that's exactly what we're going to do today. Now, this article isn't just throwing out wild claims. It's got a whole bunch of research studies cited, so we're going to have to dig in and see if the science actually backs up what they're saying.
Sounds good. I'm always up for a good challenge, especially when it comes to separating fact from fiction.
So this article we're diving into is basically marketing material for a program called Ageless Knees. And it's the brainchild of this guy, Chris Sochinski, who's a certified athletic trainer. He's got this special routine and a gadget he calls the Miracle Massage Wand that's supposed to, get this, zap your femoral nerve to get rid of knee pain.
Interesting. The femoral nerve, huh? I haven't come across that as a common target for knee pain solutions. I'm definitely curious to learn more about that.
Me too. But first, let's tackle this whole knee replacement surgery is a hoax claim. The article even throws in a study from the New England Journal of Medicine to try to back it up. But there's a catch, and it's a big one. That study was only about meniscus tears in people who already had osteoarthritis.
Uh-huh. That's a classic example of taking research out of context.
Exactly.
You always have to look at the bigger picture and understand the limitations of any study before jumping to conclusions.
Right. And in this case, the study wasn't looking at all knee replacements, just a very specific type in a very specific group of patients.
Exactly. Now, this doesn't mean knee replacement surgery is completely risk-free. I mean, it is major surgery after all.
Oh, absolutely.
And the article does bring up some valid points about potential complications. Things like infections, blood clots, even nerve damage, and the implant itself wearing down over time. Those are all very real possibilities.
Right, and they don't sugarcoat the recovery process either. They talk about it being long and potentially painful, with the possibility of people becoming reliant on painkillers.
Yeah, all important factors to consider. Knee replacement is a big decision, and you should always weigh the pros and cons carefully with your doctor.
Definitely.
But, and this is a big but, for a lot of people, especially those struggling with severe osteoarthritis, knee replacement can be truly life-changing. It can help them get back their mobility, reduce their pain, and just improve their quality of life significantly.
You're right. It's not fair to just slap a hoax label on it.
Exactly.
Every situation is different, and some people really do benefit from this surgery.
Right. It's about understanding the nuances in individual circumstances, not just making sweeping generalizations.
Okay, so let's talk about this femoral nerve thing, because that's the foundation of this whole Ageless Knees program. Their argument is that a weak femoral nerve leads to weak quadriceps muscles, those big muscles on the front of your thigh, and that weakness makes the knee unstable and causes pain. They even bring up a study from Harvard where researchers looked at ancient skeletons and found way less arthritis compared to modern skeletons, even though those folks probably had way more physically demanding lives.
Yeah, I find that study fascinating, the idea that our modern lifestyle, with all the sitting we do and the lack of, well, diverse movement, might actually be contributing to this weakened femoral nerve.
Right. It's like our comfy chairs and desk jobs are secretly plotting against our knees.
It's kind of a crazy thought, isn't it?
Totally. And they go on to cite research from Boston University and UC San Francisco showing a direct connection between weak quads and both knee pain and cartilage loss. They even bring up an Australian study where they found that people with less quadriceps muscle had less cartilage in their lower legs.
Interesting. So, strong quads seem to equal healthy knees. But the question is, does that mean that this miracle massage wand is the solution?
Right. Let's talk about this wand because I'm totally intrigued. So it seems like it uses these low-level electrical currents, similar to acupuncture, to stimulate the femoral nerve and block pain signals. And they even mention research from Johns Hopkins, King's College London, even the University of Michigan, that suggests electroacupuncture can be good for knee osteoarthritis.
Oh, for sure. There's definitely a growing body of research pointing to electroacupuncture as a potential tool for pain management. But, and it's a big but, we need more research specifically on this miracle massage wand itself. Does it actually work? How does it actually work? Are there any long-term studies? And, most importantly, are there any potential risks or side effects people should know about?
That's a great point. We need to know those answers before we even think about recommending it. It's like you always say, don't just take their word for it. We got to put it under the microscope.
Exactly. We have to be careful consumers, especially when it comes to our health.
Okay, so let's move on to the Ageless Knees routine itself. The article makes it sound super simple, beginner-friendly, just 7 minutes per knee, easy movements. But, and this is a bit of a red flag for me, they're really vague about the actual exercises involved. It's like they're giving us the recipe without the ingredients.
Hmm. Yeah. That lack of detail makes it, well, pretty hard to evaluate the routine's effectiveness.
Yeah.
I mean, it's possible that targeted exercises could be helpful for knee pain. We know exercise is good for knee health. Strengthens the muscles that support the knee, improves flexibility, even helps reduce pain.
Right. But without knowing exactly what this Ageless Knees routine is all about, it's tough to say if it really lives up to all the hype.
Exactly. It's like, how can you judge a book by its cover if you can't even see the cover?
Uh-huh. Good one. And speaking of height, we can't forget about the classic marketing tactic, testimonials. The article is full of stories from people claiming they had these amazing results with ageless knees. There's Diana Moore, Robert Sanders, Carol Baker, all singing its praises.
Yeah, testimonials, right? They can be very persuasive, and I'm sure some people genuinely do experience positive results. But, and there's always a but, we have to remember that these are just individual stories, not scientific evidence. What works for one person might not work for another. And there's always the possibility of bias, or even embellishment. People want to share their success stories.
Plus, there's that classic marketing combo. Urgency, fear-mongering, and emotional appeals. You've got the limited time offer, the doctors are hiding this from you angle, and the imagine playing with your grandkids pain-free imagery. They're hitting all the emotional buttons.
Oh, absolutely. It's a well-crafted sales pitch, for sure. And that's why it's so important to be a critical consumer.
So we've laid out the claims, peeked at the research, and started to unpack this whole ageless knees thing. But we've just scratched the surface. There's a lot more to explore. We're going to go deeper into the potential pros and cons. Then we'll give you some practical tips on how to navigate all the noise when it comes to knee pain treatments. So stick with us.
Okay, so, we have to give credit where credit's due. This Ageless Knees program, it's not all, just smoke and mirrors.
Oh, really?
Yeah. The idea that, if you strengthen the muscles around your knee, especially those quads, it can help stabilize the joint and maybe even reduce pain. Well, there's actually research to back that up.
So there's some real science behind it, but that doesn't mean this program is the miracle cure they're claiming, right?
Exactly. There are still a lot of unanswered questions like, how effective is this wand really? We need more rigorous studies, long-term ones, to really see if it works, how it works, and if there are any, hidden risks.
Right. And what about the routine itself? They're still super vague about the actual exercises. Is it enough to really address, all the different things that can cause knee pain? I mean, knee pain isn't always a one-size-fits-all problem, is it?
You're absolutely right. Knee pain can come from, so many different things: osteoarthritis, meniscus tears, ligament damage, bursitis, tendinitis. I mean, the list goes on and on. So if you're trying to tackle all these different problems with the same approach, it's like, trying to fix every car problem just by changing the oil. Sometimes you have to really look under the hood and figure out what's really going on,
I love that analogy. So what you're saying is getting a proper diagnosis from a qualified healthcare professional.
Yeah.
That's crucial, right? They can figure out what's actually causing the pain and recommend the best treatment.
Exactly. I mean, it could be physical therapy, medication, injections, or, sometimes even surgery.
Okay, so this Ageless Knees program, it might be helpful as part of a bigger, more personalized plan, but it's definitely not a replacement for seeing a doctor.
Exactly. And, another thing, it seems like they're really playing on people's fears about surgery. They're focusing on all the potential negatives, but they don't really talk about the potential benefits.
It's almost like they're trying to scare people away from traditional medical options.
Yeah, it's classic fear-based marketing. And, it can work, unfortunately. But as we've talked about, knee replacement is a lot more complicated than that. Yes, there are risks, but it can also be really, really beneficial for some people.
So the bottom line is, talk to your doctor, understand the risks and the benefits, and make an informed decision that's right for you.
Exactly. And don't forget, you always have the right to get a second opinion. If you're not comfortable with what one doctor is saying, get another perspective.
Absolutely. Okay, shifting gears a little bit here. What about this whole electrical stimulation thing? I mean, using electricity for pain management, is that even a real thing?
Oh, it's definitely a real thing. I mean, there's a lot of research into it, and some evidence suggests it can help with things like osteoarthritis. But we need to be, cautious.
So the idea itself isn't totally crazy.
No, not at all.
But there are some things to keep in mind.
Oh, absolutely. First, remember we talked about this miracle massage wand specifically. Well, it hasn't been studied as much. We don't really know the long-term effects or if it's safe and effective for, all types of knee pain.
And it's not a cure, right? It might help with pain, but it's not fixing the underlying problem.
You're exactly right. It's like taking a painkiller for a headache. You might feel better for a little while, but if you don't figure out what's causing the headache in the first place, it'll probably come back.
That's a great way to put it. So even if this electrical stimulation does provide some relief, it's just one piece of the puzzle.
Exactly. And, just like with any treatment, there are potential risks. Electrical stimulation, it can cause skin irritation, burns, even muscle contractions in some people.
Yikes. So people need to use these devices properly, and if they experience any weird side effects, definitely talk to their doctor.
Absolutely. Safety first. But, getting back to that Harvard study about the ancient skeletons and less arthritis, it really makes you think, how is our modern lifestyle impacting our knee health?
Yeah. It's crazy to think that our comfy lifestyle might be hurting our knees.
Right. We sit all the time. Our diets are different. We move in very limited ways. It's not just about age or wear and tear. It's also about how we live.
So what can we do about it?
Well, prevention is key. If we want to keep our knees healthy, we need to move more, stay active, challenge our bodies with different types of movement.
So it's about being proactive and not waiting until it's too late.
Exactly. And remember, moving doesn't have to mean crazy workouts or anything. Simple things like walking, swimming, cycling, even gardening, all those things can make a big difference.
So find something you enjoy and make it part of your routine.
Yeah. And most importantly, if you have knee pain, don't ignore it. Talk to your doctor, explore different options, and ask questions.
That's great advice. We've covered a lot today. Hopefully you've got a better understanding of this whole knee pain thing. But before we wrap up, we want to leave you with one last thought-provoking question to chew on. So stay with us as we head into the final part of our deep dive.
Okay, so after all that, I think it's safe to say this whole knee surgery hoax thing is, well, a bit of an exaggeration.
Right. I mean, there are definitely things to consider about knee replacement surgery, but this article blew it way out of proportion.
Totally agree. But, after going through all this research and these different perspectives, it really makes you think about how our modern lifestyle affects our knees.
Yeah. Oh, yeah, absolutely. Remember that Harvard study about ancient skeletons? How they had way less arthritis, even though their lives were probably a lot tougher physically than ours are today.
It's wild, right? Are our comfy chairs and desk jobs actually our knees' worst enemies?
Well, it definitely raises some interesting questions about how our environment and our habits play a role in our knee health. I mean, we sit for hours on end. Our diets are totally different from what people ate back then. We move in very specific ways and often repeat the same movements over and over again.
Right. So how is all that impacting our knees in the long run?
Yeah, and what can we do to counteract those negative effects? It's almost like we need to re-engineer our lives to be more knee-friendly.
It makes me wonder if we should bring in an anthropologist and a biomechanist for our next deep dive. Get their take on all this.
Ooh, now that would be an awesome episode. But seriously, it's something we should all be thinking about. What small changes can we make in our daily lives to keep our knees healthy?
Exactly. Maybe it's as simple as standing up more, or varying our movements, paying attention to our posture. Little things can make a big difference.
It's all about being proactive, right? Yeah. Not waiting until our knees start screaming at us before we start taking care of them.
Exactly. The more we know about how our choices affect our bodies, the better decisions we can make.
Well said. I think that about wraps up this deep dive. Hopefully you learned some new things today.
Yeah, and maybe even spark some curiosity about the amazing connection between our bodies and, well, just the way we live our lives.
It's all connected, isn't it? Well, that's it for today. Thanks for joining us for another deep dive.
And to our listeners, keep asking questions, keep exploring, and keep taking care of yourselves.
See you next time.